I'm not able to speak to specific actions that have been taken around COVID-19 in BC, but
Yeah.
just in terms of general public health pieces around contact tracing and testing and viral spread and containment, yeah, I can talk about
Okay.
that for sure.
Okay. So shoot. what what's contact tracing? Because it's been talked about so much.
Yeah.
What does that really entail?
So, Desiree, it's a great question, and contact tracing is one of the essential components that is going to get us out of the current curtailments and closures, and especially as provinces reopen. I mean, I do know one thing I do know, at least from the popular media, is that BC is reopening.
Yeah.
Here in Ontario, we're also moving to phase one with certain things reopening as well as of tomorrow.
Yeah.
And so, really, what contact tracing is essentially there's three things that you're doing. First thing you're trying to do is you're trying to figure out where the person may have contracted the disease. So this is done not just for COVID-19, but we do this for all manners of infectious diseases. So things like chlamydia, tuberculosis, you name it. Like we'll do contact tracing for that stuff as well. So this is bread and butter
Right.
public health. But in any case, what happens is when someone's diagnosed with the disease, let's say in this case COVID-19, there are three things we want to do. First of all, the individual that's diagnosed needs to be given some advice and some direction as to what they need to do. So whether it's go home and self-isolate for 14 days, and we'll check in on you regularly. That's one part of it called case management. The other thing is an exposure assessment, which is basically where you're trying to figure out where the person may have got the disease from. So you kind of try to work backwards and see had they traveled somewhere, had they had close contact with someone who might have had COVID. And so that's called an exposure assessment. You're trying to figure out where they got it from. And then the third most important part of contact tracing is the actual tracing itself, where you're basically trying to figure out when was this person infectious and who did they come in contact with during that time. And so this is where you need to figure out who they've had close contact with, because we know this disease is spread through close contact droplets, usually over like 5 to 10 minutes with someone else.
Right.
And we do know that it also spreads pre-symptomatically sometimes. So sometimes just before someone develops symptoms, they may feel completely well, but they're also still spreading the disease.
Right.
So what we do is we calculate a couple days before the person's symptoms started to when they were diagnosed, and then basically when the measures came into place, and then we try to figure out where they may have been, who they may have come in close contact with, obviously their household, maybe people at work, maybe people uh, here and there. And that actually allows us to then reach out to those people and say, you've been exposed to COVID-19. You should actually
Ah.
be looking for symptoms and probably staying home to make sure that you don't spread it around in case you might be infected, and
Oh
also
wow.
that they should get tested. So it really is like kind of a bit of sleuthing. And I'll be honest with you, the thing about the closures and the curtailments, that was actually really helpful for contact tracing. Because if you think about it, if you're just staying in your household bubble and if you get sick, the only people
Ah.
you've really had close contact with are people in your house. So that actually makes it
Right.
easier to do contact tracing. Whereas
Right.
in the first part, when this thing was out in the community, I still remember we had cases like people went to like the grocery store, the bank, they went to a nightclub, and then it was just like, the number of contacts you had to follow up on, it became really challenging. But
Right.
that's
Right.
contact tracing in a nutshell.
How are you going to go ahead doing this? Are there any tools that are going to be in place that ideally as the health authority is going to look for to try to be able to work with to figure things out?
Yeah, all health authorities use the same kind of tactics in the world. So certainly, for example, Alberta's introduced a contact tracing app, but an app is only really useful if it's taken up broadly, and if it's
Right.
not taken up by a lot of people, and plus there are lots of privacy concerns, etc., with an
Yeah.
app. So that really makes an app kind of more of an adjunct to what we do in public health, and really. The bread and butter part of public health is case and contact tracing. And so basically, we've got public health nurses. They will basically call the individual. They'll do a questionnaire, figure out all these different places they may have been,
Right.
and then, for example, if they went to their office, we'll figure out where they sat, who they might have exposed, who was in the office at the same time, and then we'd use the employee directory to call people. We've had situations, for example, where we had people, a positive COVID case, go into a nursing home to visit their parent, for
Right.
example. And in that case, what we did is, the nursing home has closed circuit TV, so we could actually follow this person Like, so
Oh
it really is
wow.
like
Well,
being a disease detective, right?
yeah,
It's
yeah,
like trying to, but basically, and of course we all get consent for all this stuff before we start our investigation. But a lot of
yeah.
people do want to do the right thing and help the community, and so we use every tool at our disposal to try to figure out where the person may have been, and that's going to become more important because right now a lot of people have just been sitting around at home, which makes it really easy for which both reduces spread because they're not out there
Right,
interacting with people.
right.
It also makes it easy for contact tracing. But as we start to have people go out into the world, and to some extent, what we tried to do with the closures, while closures were there, things didn't stay static. We trained up a whole bunch of contact tracers, at least here in Ontario. We trained up a whole bunch of
Okay,
people to do contact tracing. We raised our lab capacity, and so now the idea is that people can start going about their lives again. But if they're getting symptoms of COVID, at least hopefully we have the capacity to test them quickly, and then we have the capacity to follow up on their cases and contacts so that we can interrupt spread quickly. So we were ramping up that capacity while things were kind of closed and slowed down for the last
okay,
little while.
cool. Um, what I guess now there's a push towards if I think there's trials coming up with a potential vaccine. I can't
Yeah.
remember the name. Um, okay, on a personal level, I'm happy, but I'm also scared. like wow, it's going fast.
Yeah, well, the thing about vaccines is that there is a rigorous process that ensures that they are safe and effective before they get to market. That's
Yeah,
also part of the reason why it takes such a long time, like 12 to 18 months to get a vaccine going.
right,
So basically, what they do is there's usually different phases. So the initial phase is basically you're just trying to see if it's effective and safe in healthy human volunteers. Then
right,
the next step of the clinical trial is you then need to identify a number of different a number of representative populations. So something that looks more like the community in order to trial it. And then after
right.
that, there's a whole bunch of safety checks that need to be undertaken. And then once those are undertaken, you're good to go pretty much. So
Okay,
there is a lot of thinking that goes into vaccines and just making sure that they are safe.
okay. What I wonder if I did a little bit of like I don't know if I did any kind of real research. I'm definitely not. Yeah, all I did was watch YouTube.
That's
A
okay.
ton. I did a ton of YouTube. I did read some things, but I did a ton of YouTube just looking into virology.
Yeah.
Is it in regards like treatment, like so? I'm thinking of contact tracing. Some of the reports that I've heard is that in some cases, and I don't know if that's the case. Um, I can't say that I've actually heard anything about it being the case necessarily in BC or in any parts of the rest of Canada. But is there? I mean, I know like some people supposedly they've had contact or they've been diagnosed with COVID, but they've died or passed away from some other reason, but they're counted as a COVID death.
Mhm.
Is there a breakout?
If you really want to figure out if COVID caused the death, then
Right,
you actually need to do a detailed autopsy, like a postmortem analysis, right?
right,
And the challenge with that is even if you do that, there's still no guarantee that you're going to be able to figure out what the actual, like whether it was COVID or whether it was something else. You'll do the autopsy and you'll say, on a balance of probabilities, it might have been this or it might have been COVID, but you'll
mm,
never really know for certain because again, there's different complex like biochemical and kind of like you're looking at issues in the blood, issues in the lungs, all these other
mm,
pieces. So a lot of the times you basically just have to say this person died and they had COVID, and so we're going to count it as a death, a COVID death, as was
right,
described.
right,
Um, but it's basically a matter of first of all we'd have to autopsy everyone. Second of all, the other issue is there isn't really the broader capacity to really delve into that right now. Really, the focus has been on trying to direct our healthcare resources to containment and controlling spread.
right,
Um, so there's all that, and I think the better metric, if anything, is less about the actual deaths, but more just looking at deaths as a whole in terms of excess. And I'm sure you've seen this throughout the world. The idea that over the last few months, in many places in the world where COVID has sort of rampaged through, they've seen way more deaths than they would have in a comparable month over the last 10 years. So, for example, in March 2020, you're
Right.
seeing like 4 times, 5 times more deaths in New York City than compared to Marches previously. Now, you could say that sure, maybe there's some other factors that are related to that, but given that COVID is also there, many of these people are dying, with pneumonia and with other pieces that you're maybe not necessarily confirming through an autopsy. I think the there may they to be fair, Desiree, I'll see your point. Maybe it is there may be certain deaths that are overcounted, but I don't think the proportion of deaths that are overcounted would be enough to invalidate the whole number. I think it's probably capturing most of the toll of COVID. Maybe there's a few ones in there that are just kind of like, oh, they kind of died of something else. But whether COVID was even part of the chain that led to that something else, um,
Right.
it's tough to know, and it's better to just at this point go with that as the metric. So
Okay. In a broader term, obviously, this is not. We are dealing with the way things are as they are right now. I mean,
yeah,
where whether the government as a whole we decide to, you know, continue down the path of using distancing primarily as a model or locking things down when needed and so forth going on for the next, who knows, couple years, depending on how things are going, or whether or not we decide to open it up. It doesn't really, it's kind of out of our hands. But in an ideal world, and I know that you're not speaking for, for the Peel region on this, but looking at it scientifically, or is there a better way for us as humans to live than we're living now? Like, I think it's great. I think this has brought a lot of people. They're heightened as to how they live their life.
yeah.
I look at New York and I look at this is a massive city crammed with people. Um, yeah, of course it's going to get hit if something goes off there because you're just all together. Um, how are we eating? The biggest hit on business, there's businesses, and I would say that probably the food industry has suffered a massive hit economically. At the same time, we know that if you're a person eating out, and I'm one of those people, um, you're probably not as healthy. Again, I'm one of those people that you could be if you're eating, a good balanced diet of fruits, vegetables, and proteins. Balance, probably from farm to table would be even better. You know, um, than some of the highly saturated, salted foods that you get in most restaurants. Um, is there a better way for us to live to be able to deal with viruses? Have we created these viruses? Have we created this situation?
So, Desiree, it's a great question. And I think the big thing you have to remember is that we are seeing all kinds of emerging infectious diseases nowadays. And a lot of it is because, as you've described, like humanity is, as our cities expand, as our need for natural resources continues to grow, humans are starting to go into more and more places where they traditionally haven't ventured. And the other part is also, as you mentioned, with our cities being crowded, with climate change happening, and so vectors can live.
Right,
Like there's a lot of factors here that are leading to resurgences in infectious diseases, and also brand new infectious diseases like the one we've just seen there. I
right,
think the reality is that wherever there's always going to be human beings, there will always be some sort of risk of a contagion. Um, that said, I think there are steps that we can all take, and I think what we've done, at least in the interim, with the closures, was we were trying to weigh the immediate risk of essentially like significant death and sickness that would have overwhelmed our hospitals. Healthcare workers probably would have troubled and traumatized paramedics, first line responders, healthcare workers, long term care workers, and many of them, especially here in Ontario, where we've had a bigger long term care crisis than you folks
right.
had in BC.
Yeah,
Those people are going to live with that for the rest of their careers and their lives. And imagine if that was like on a New York or Wuhan level scale, it would
right,
have been terrible. So that was the immediate threat. we have
Right.
always recommended that we've always recognized that the closures were not going to be permanent. Like these were,
Yeah.
because we knew that the longer the closures last, you're going to have, other long-term impacts in terms of, people who are suffering, say, from domestic violence, people who have mental health issues, who are
Yeah.
suffering from loneliness, isolation. So it's always been trying to thread this needle between these two extremes. And really,
Yeah.
what we did with the closures is we managed to get the virus under control. The thing that no one talks about when they talk about flattening the curve. When you flatten the curve, what you're essentially trying to do is you're trying to take back control from the virus. Because
Right.
before we closed down, the virus was dictating the timeline, right? The virus was like,
Right.
I'm going to spread, I'm going to just take advantage of all your relationships and interactions and all this other stuff, and that's how we're going to do it. By shutting it down, what we've now done is we've taken control back from the virus. We've got the fire under control. And then
Right.
how we open up and live our lives in the coming months is going to
Yeah.
allow us to let this be a controlled sort of return to some sort of normalcy with a lot of distancing and hand hygiene and all that other stuff that
Cool.
otherwise wouldn't have been possible. So I know a lot of people have definitely taken a hit and sacrificed a lot over the past 2 months. I think it was done for a very worthy cause because in Canada we have had, BC, Ontario, Quebec, Alberta, like even though there's differences between them, on the whole, we in Canada have actually done probably the best out of every other G7 country in the world, save and except possibly for Germany and Japan. If you
Right.
look at
Right.
the rest of our counterparts, we've done great. And so now it's a matter of let's open this up gradually. Let's now that we're back in the driver's seat with this virus, and we'll figure out how we can live again so that we're not we're pushing off those other negative impacts of a prolonged closure. So
Right. So what if we end up seeing like a resurgence? What do you think? I mean, I don't. Do you have? Is there a plan? Like, is there going to be a better attack? Like,
yeah,
a
yeah,
better
no.
counterattack?
So I hope the thing about it now is we're a lot better prepared now, right? So as I mentioned, while things were closed, we ramped up our contact tracing capacity, we ramped up our testing capacity, we got our hospitals set and ready. Of course, they're going to have to deal with an elective backlog now for like things like surgeries and cancer treatments. They'll have to deal with that. But the
Yeah.
reality is that we added to our capacity. So if there's a second wave, we can hopefully tolerate a little bit more transmission before we need to start implementing stricter restrictions again. But
Yeah.
the idea is that over time, it's going to be what is called dynamic distancing. So uh, over the next, like, until there's a vaccine or a cure, probably over the next year and a half, we will loosen things as the waves come down, and then as the waves go up again, we'll just need to tighten back up and just make
Yeah.
sure that the community. But basically, it won't be as I would say it wouldn't be as sudden and precipitous as the first time we did it, because at least this time we've got the capacity to buffer and we've got
Yeah.
an understanding of who we're dealing with. So
Right. Right. Well, I thank you for speaking with me about this. It's a lot to take in. It's a
yeah,
lot
you know what?
to process.
Thanks so much for having me on the show, Desiree. And I'll be honest with you. Uh, Canadians really stepped up in a big way. I know it's been hard. I know it's been a lot of sacrifices. We have to also remember there are people who have lost loved ones to COVID-19.
Yeah.
In our community. But I really do think we've come together in a really big way, and that's why I've been very proud of the results that we've seen in this country. Like we're not a small nation like New Zealand. Everyone points to New Zealand and say they did great, but I mean, there's 5 million people in the entire country. They basically fit into the entire GTA, and they're spread out over two tiny islands.
Right.
Um,
Right. Right. Right.
we're connected to the epicenter of the COVID-19 outbreak. The United States, and
Right. Just across the
we
border.
still yeah, and we still managed to come out of this pretty well unscathed. So I know it's been a long time. It's been a lot of waiting around at home. I'm doing it too,
Yeah.
but I
Fun.
think Canadians definitely have come through in a big way. We just need to keep it going.
Yeah. Right on. Well, I appreciate it. Oh yeah. One thing. One thing. Um, do you think it's gonna get to? I guess this is probably not even in your realm because this is more of a policy thing. Would it be something if there's a vaccine? Does it work if it's given out? Um, to those who want it, but there's a choice? Does it still have value? Or is it something that needs to be, will it get to a point that we're going to be starting to discuss mandatory or obligatory? Is
Yeah.
that something that'll even come up?
Well, again, that is a decision. That'll be a decision for policymakers. But our broad recommendation. So vaccines do two things, right?
Right.
At an individual level, if it's safe and effective, then it
Yeah.
protects the person, right?
Right.
But at a broader community level, if enough people take it up, then it actually helps to stop or interrupt transmission in the community. And we've seen this with, other diseases like smallpox, like measles.
Right.
That's how we've managed to control a lot of these diseases in the past. So
Right.
it'll be up to policymakers to figure out to what extent they want to have the second outcome. And
Right.
in that case, mandating or at least um, requiring vaccinations for specific things. For example, in Ontario, we require them for school entry. Either you get them or you sign a philosophic exemption.
Right.
Um, those have been shown to increase uptake levels that really support that community immunity that we need.
Right.
And so, again, we recognize that there's, the debate around vaccines is acrimonious, even in the best of times.
Yeah.
Um,
Right.
but to the extent that it helps individuals, I think that choice will always be there. But to the broader extent of how do we want to come together as a community and really stamp this out, it'll be up for policymakers to figure out how they actually want to tackle that.
Yeah. Right on. I think that was it. That was it. That's all I kind of I had. So
Awesome,
thanks.
Desiree. Thanks.
Yeah,
Yeah, thanks
man.
so much for the chat, and happy to chat again at any